How does having a hiatal hernia impact your digestion? It impacts not just your digestion, but actually your entire body and your body's health and your longevity. So it gets pretty serious ignoring a hiatal hernia. So let's look initially at how it impacts digestion and what is a hiatal hernia. So a hiatus is a hole or an opening, and a hernia is when something is protruding through an opening and it shouldn't be. So a hiatal hernia is when your stomach pushes up above your diaphragm. It should be nicely below your diaphragm, and what connects your mouth to your stomach is a tube called the esophagus. So the esophagus does pass through the diaphragm, and then the stomach is below. But what happens with the hiatal hernia is that the stomach gets compressed, and then due to that compression, upward pressure occurs, and over time that opening of where the esophagus is passing through the diaphragm widens, and that's called a hiatal hernia. So the stomach has moved up. Now 95% of hiatal hernias are sliding, meaning it moves up, it goes back down, up and down like that. So it's very common for there to be motion, and sometimes patients say, I can tell when it's up versus when it's down. Now, where does the impacting digestion come from? Typically, with the very nature of having that stomach compressed and pushing upwards, that pressure is going to cause your stomach acid within your stomach to move up your esophagus. So the classic complaint initially is acid reflux. You have heartburn, you have acid reflux, people call it indigestion, and it takes a little while if you've never had this symptom to know what it is. I remember I had it during pregnancy, which is very common at the end of pregnancy when everything's getting squished. And I had this feeling, and it actually took me a couple days, and I'm a clinician, but I'd never had it before. And I was like, oh, this is heartburn, So it can take people a little bit of time to sort of understand what they're feeling, but then it starts with the over-the-counter Tums and something chewable, et cetera, to handle this indigestion. And it's not until it gets more chronic and you're more miserable with it that then you might be prescribed a PPI. And unfortunately, these proton pump inhibitors, which are prescribed strong antacid, are used, I wouldn't say indiscriminately, because you have to have a problem, obviously, to get the prescription. But then way too often doctors are telling their patients it's totally fine to stay on this for years. If it makes you comfortable, fine, just keep taking it. And that's where we run into a problem. So that's where we start affecting digestion, because what happens is when you're taking this antacid and it's lowering the acid content within your stomach, it doesn't allow your stomach enzymes to activate. You need a certain amount of acidity within the stomach to turn an inactive enzyme into an active enzyme. And so one of the things that the stomach enzymes do is break down protein. So you're not being able to break down your protein and start being able to utilize it and assimilate it for all the wonderful things that it does. And gas and bloating are a common side effect of when you're not being able to break down your protein adequately. That's bad enough, but in addition to that, what you have is the fact that we are exposed to bacteria in our food. It's just normal. And that's why we have this acidic environment to kill the bad guys before they gain further entry into our body. So when you're taking these antacids and you're lowering the amount of acid in your stomach, you're very much setting yourself up for infections. And they can be quite serious infections. Small intestinal bacterial overgrowth, so an overgrowth of bacteria in the small intestine, which can be very miserable, lots of gas and bloating, lots of distension, diarrhea, constipation. That comes about from this offsetting of the normal pH of our digestive tract. So it's a beautiful system, the human body. Think about it, the stomach is a bag of acid, but then as soon as the contents leave the stomach, then there's an alkalizing effect when it gets to the small intestine, so its enzymes can work. But every step has to occur, and when it doesn't, then we really have a problem. Now, in addition to the not breaking down the proteins and the increased risk of infection, What we also have is that we have a leaky gut. So this bacterial overgrowth is allowing, is kind of overwhelming, if you will, your immune system. And so you get the bacterial overgrowth, but then that overgrowth is sort of wearing down the defenses of your immune system. And you start also getting your immune system saying, I don't like all this bacteria, and it's kind of getting revved up, or inflammation. So that's a sign of your immune system getting activated and overly activated. So you get into a chronic inflammatory profile. And that chronic inflammation, we know, is the root of all the diseases you don't want, from diabetes to heart disease to dementia to autoimmune disease to cancer. They all have the same root, and that is an inflammatory profile and an immune system that's gotten overwhelmed. So hopefully I've made a case for why, if you have acid reflux, if you have any sort of indigestion, if you've been diagnosed with a hiatal hernia, but you're told, oh, it's small, there's really nothing to do, just keep taking your antacid, that's fine. It's not fine. It's leading you in a direction of ill health that not a lot of people are connecting the dots to, you see? So hopefully I have connected the dots well. So if you've got the bloating, gas, you've got the reflux, feeling of indigestion, constipation, diarrhea, nausea, any of these symptoms, yeah, of course, take something to alleviate it if you can, but just don't stop with the Band-Aid. That's what I'm urging you to do, is really get to that underlying root cause. It's not hard to fix, and the permutations, the effects across your body and your health are really magnificent, and you'll be glad you did. So until next time, I wish you very good health.